Parasitic zoonoses status in India. Parasitic zoonoses status in India. India is southeastern tropical Asian country having total human population 1,211 million, 485 million livestock, 489 million poultry, high wild and semi-wild flora and fauna, occupying just 2.4% of world surface area. Close intimate contact with animal. Further, low socio-economic status, lack of sanitary measures, lack of awareness, deficient potable water supply, religious activities, be tapeworm in Muslim and pork tapeworm in Hindus. Regional activities, dog and crab delicacies in any of country lead to paragonimiasis. Poor surveillance and inefficient action of government functionary bodies, rise in immunocompromised individual, especially HIV, change in the lifestyle. In India, endemicity of old parasitic zoonoses, emergence of new ones, rise in neurodegenerative disease, rise in opportunistic infection, loss of man-day, hug economic loss to livestock industry. Parasitic zoonoses, different mode of human infection are food-borne, vector-borne, inanimate object-borne, via soil, plant, saprozoonoses. Based on etiology, helminthic, trematodal, protozoal, cystod, arthropoda, nematodal. Trematodal, snail-borne disease. Trematodal, snail-borne disease. Trematoda find host, intermediate host, transmission to human. Faciliopsis, Faciliopsa busci, man, dog, and buffalo pig reservoir snail, ingestion of metacercaria on water chest. Schistosomiasis, hematobium mansoni, japonicum, man and other mammals snail skin penetration by bacteria. Clonorchiasis sinensis, Chinese liver fluke, man, dog, cat, pig, rat. First snail, second freshwater fishes, especially cyprinid, injection of cyst in fish. Opisthorithiasis fallinaceus viverini, man and fish eating mammals, dog and cat reservoir. First snail, second cyprinid fish, injection of cyst in fish. Paragonimiosis, Paragonimus westermani, man, dog, cat, and other mammal. First snail, second freshwater crab and frails fishes, injection of cyst in crab meat. Fasciolopsiasis, Fasciolopsis busci, intestinal ulcer disease in human and pigs are final host, pig are reservoir. Infective stage, metacercaria was injection of contaminated water, chestnut and walnut which are eaten raw. Occurrence, area of endemicity are large part of the People's Republic of China and Taiwan, India, Bangladesh, Indonesia, Thailand and Vietnam. Disease occurs focally and is most prevalent in school-age children. The prevalence of infection in children ranges 60% in India, 57% in China, 50% in Bangladesh, 25% in Taiwan and 10% in Thailand. Schistosomiasis bilharziosis, common in tropical and subtropical area. Schistosoma species zoonotic type of infection, occurrence highly prevalent reservoir host. Schistosoma hematobium, schistosomiasis of urinary tract, North America, not import but monkey, pig and rodent may play role. Schistosoma mansoni, intestinal schistosomiasis, East Central and West Africa and Egypt, monkey and rodent. Cystosome japonicum, Asian intestinal schistosomiasis, Southern and East Asia, domestic ruminant, dog and rodent. In India, Schistosoma hematobium is endemic in village Jimvi, Ratnagiri district of Maharashtra. Percutaneous penetration of infective stage Cercaria. Skin lesion, hepatomegaly, lymphoadenopathy, and cephalopathy. Many species are known to cause swimmer itch, but no authentic information on prevalence in human. Schistosoma cercaria, swimmer's itch, cercaria dermatitis, clonchiasis and opisthochiasis. Clonchiasis and opisthochiasis, both parasitic in bile duct system. Clonchiasis sinensis occurs in all Asian countries in Korea, Vietnam, Taiwan, and the People's Republic of China. Prevalence rate in human are up to 50%. Besides human, cat, dog, pig, and various carnivores are surviving as final host. Opisthochiasis species sorry sorry Opisthochiasis species endemic area Opisthochiasis felinus eastern and southern Europe Opisthochiasis vivirini Southeast Asia and East Asia. Human infection occur by injection of uncooked or undercooked freshwater fish, especially sprinid fishes, example carps. Paragonimiasis pulmonary dystomiasis. Paragonimiasis pulmonary dystomiasis. Lung fluke of the genus Paragonimum. Paragonimum westermani is predominantly in Central, Southeast and East Asia. High prevalence in human is expected in northeastern states in India as crab and dog meat are delicacies there. Nematodal zoonotic hookworm infections and cyclostomiasis. Zoonotic hookworm infection and cyclostomiasis. Encyclostoma species disease in human final host. Encyclostoma caninum eosinophilic enteritis occasionally dog. Encyclostoma brasilensis cutaneous larva migrans CLM dogs. Encyclostoma salienicum anemia and intestinal infection dog and jungle cat civet. Encyclostoma caninum is the most common and is worldwide. In Madhya Pradesh, prevalence among stray dogs reported in 89%, and in tea-growing community in Assam it is 72%. Up to 60% of dogs in tea-growing communities of Assam harbored a Braziliensis, with 37% of dogs having mixed infection with Braziliensis and Canivanum. High incidence of CLM in the area and majority of individuals 67% admitted to walking before foot while outdoor. Humans are accidental hosts and get infected by percutaneous penetrate of larvae. There are reports of Salmonella infection in dogs despite the isolation of the hookworm in 16 out of 173 humans from the Hooghly region. CLM creeping eruption disease is acute and self-limiting. Etiological agent favorable climate. Encyclostoma brasilensis tropical and subtropical. Ancineria stenocephala cold and moderate climate. Cutaneous larva migrant CLM. Visceral larva migrants. Visceral larva migrants, a syndrome caused by the invasion of inner organs, liver, lungs, brain, or the eye by nematode larva of the genus Toxocara canis, and to a larger extent Toxocara cati, Toxocara mixtex, parasitic definitive host, paratinic host, paratinic host. Toxocara canis, dog, fox, less prevalent in other canis, example, coyote, wolf, jackal. Essentially every species of mammals and bird. Toxocara carti, cat and other felidae, rodent and bird. Belicercaris, Procynus, raccoon, rodent and bird. Human infection occurs worldwide. Antibodies to Toxocara canis are found worldwide in 2 to 40% of the human population, with higher prevalence in children than in adults. Humans are accidental hosts and get infected by accidental injection of embryonated egg. In dog, parasitic survey found Toxocara canis to be most common parasitic of stray dog in Miraj and Kolkata. By contrast, the prevalence of Toxocara canis in adult stray dog in Madhya Pradesh was found to be 2.7%, and in tea growing communities in Assam it was 11%. In another study, 46% of public park and 32% of school ground in Andhra Pradesh were contaminated with Toxocara ova. In a random rural survey in Haryana, 6.4% prevalence rate was found. Extending 23.3% prevalence has been found in Chandigarh. In ocular cases, rate was 20.5% in Delhi. 4 types of clinical syndrome associated with Toxocara canis are VLM, OLM, neurological, covert toxocariasis, ocular larva migraines, OLM, trichinellosis, 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 trichinosis, nematode of the genus Trichinella, caused by consumption of poorly cooked meat of a number of species, especially of pig. Autopsy survey indicate that about 2% of the population is infected globally, more frequent in temperate than tropical area, incident higher in water season. In India, most of human cases to undetected in past May human cases has been reported by different workers. 50.79% prevalence rate in panthers and tiger of that Ranthambore National Park has been reported. In number of species like cat, bandicoot, and country pigs, Trichinella infection has been described. Strongyloidiasis, 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 Strongyloides species occurs host species. Strongyloidiasis stercoralis, cosmopolitan, human, dog, cat, and primate. Strongyloides Fubleborni, old world, human, and primate, and as asymptomatic or sometimes, particularly in immunosuppressed patients, severe parasitic can also cause CLM. Approx 80 million people may be affected worldwide. Besides percutaneous penetration of larva, galactogenous infection and autoinfection are important. Galactogenoses occurs in women immune to strongyloids. Autoinfections are important in immunocompromised individuals. In India, a recent case of disseminated as stercoralis has been documented in a HIV-infected patient at Army Medical College, Pune. Filariasis, lymphatic filariasis, Vaucheria bankrupt, non-genetic, Brugia malei, both genetic and non-genetic. Dirophilariasis, genetic in country, Diphtheria repels natural host in dog, subcutaneous lesions only. Transmission is by bite of various mosquitoes. In Kerala, A high prevalence of filaria worm in the subcutaneous tissue and subconjunctival space of human being has been found. From Gala 12 worm specimen of Dirofilaria repens have been identified from human cases. During the same period, in 7% dog blood smear, microfilariae have been detected. Cystodal, 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 teniasis and cysticercosis. Teniasis and cysticercosis. Tinea species adult tapeworm final host, metacystod intermediated host. Tinea saginata, human, cattle, reindeer, wild, ruminant. Tinium solium, human, domestic and wild pig, human, also dogs. Tinea saginata asiatica, human, domestic and wild pig, also cattle, goat, monkey. Teniasis non-fetal. Cysticercosis often neurocysticercosis and is lethal. Cysticercosis, neurocysticercosis most common. Ocular cysticercosis, muscular and aciconnective tissue 10% in India. Neurocysticercosis is responsible for most of the morbidity and mortality observed in case of human cysticercosis. At HIMS Hospital, Dehradun, 32% patient clinically manifestation neurological sign were positive for tinea solium IgG antibodies in their sera. Among these patients, children were most affected. In Pondicherry, male blood donors are found to be positive for either anti-cysticercus antibodies or antigen by ELISA. A number of ocular cysticercosis cases have been reported in the South India. In a study of IVRI, 3% prevalence of neurocysticercosis has been in 200 slaughter pig brain sample in the Bareilly region. Diphyllobothriasis, 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 Diphyllobothrium lectum, the largest cystod of human, predominantly in temperate and subarctic area of northern hemisphere. Infection by injection of uncooked or partially cooked contaminated fish. Beside human, major hosts are cat, dog and pig, but all other fish-eating mammals may become infected. Megaloblastic anemia and neurological signs are the manifestation of disease. In India, the disease is uncommon. Recently, a rare case has been reported from Pondicherry in a 5-year-old hailing from a fishing community. Echinococcosis, one of the most important and globally widespread hem-melting zoonoses. Echinococcus species disease in human called occurrence. Echinococcus granulosus, classical hydatidosis, cystis uniocular echinococcus worldwide. Echinococcus multilocularis, alveolar hydatid disease, multiocular echinococcosis for geographical region of northern hemisphere. Echinococcus vogeli and Echinococcus oligerathus, polycystic echinococcus, Central and South America. In country, an isolated case of alveolar echinococcus caused by Echinococcus multiocularis was reported from a man from the hill region of Kashmir, but no animal reservoir has yet been identified. Cystic echinococcus is chronic disease caused by expansive growth of echinococcus cyst metacystod in liver, lung and spleen etc. Adult worm in dog, other canid and large cat, lion and leopard, but rarely in house cat. All domestic animals can act as IH, but major genetic problems occur in sheep rearing region. Men get involved as an accidental and dead and host. In 50 to 70% human cases, cyst metacystod from in liver followed by lungs, spleen and peritoneum. The mean age when patient develop clinical sign is approximately 50 years. Clinical case of echinococcus high, high cyst content positive Cassoni skin test. In India, echinococcus is present in most of the state of which Andhra Pradesh and Tamil Nadu predominantly. Pulmonary hydatidosis from Andhra Pradesh, Gujarat, Himachal Pradesh, Maharashtra, Rajasthan, Tamil Nadu, and Uttar Pradesh were recorded. In 50 to 20% of patients having multiple multiple cysts have been found to be 66 in liver, 20% in lung, and 10% in other part of the body. In a retrospective study at PGI CHD, a significant increase in seropositivity was observed during the 1992-3 as compared with 1984 to 1998. A similar increase was also observed in Keshoni skin than earlier. In dog, prevalence ranked 3.5% to 33%. In Kurunul, the prevalence of infection was higher in stray dog near slaughterhouse compared with stray dog away from the area. In other species, Thepleal reported prevalence in cattle, in buffalo, in sheep, in goat, in swine and dog. Singh and the reported prevalence of larva Echinococcus granulosus 48.1%, 30.5%, and 21% among buffalo, sheep, and goat, respectively, in northern India. Protozoal. Trypanosomiasis, zoonotic, Trypanosoma brucei, sleeping sickness, Trypanosoma cruzi, Chaga disease. Non-zoonotic Trypanosoma evansi in cattle, non-pathogenic Trypanosoma levis in rodent. Zoonoses. Recently, 3 human cases in India. Out of 3, 1 succumbed to death. First case, 56-old farmer from Shivani village in Chandrapur district, Maharashtra on 11 January 2005, treated with suramin and curd. The parasite was reported to be Trypanosoma evansi, a vet practitioner. Second case, 57-year-old water supply from Pune in May 2007. Despite the treatment, he died in November 2007. The parasite was identified as Trypanosoma levis, non-contact with cattle. Third case, 2-month-old girl child from Mumbai. After treatment as Pulse Vedya Hospital, Mumbai, she was declared healthy, but she is being monitored. No contact with cattle, but father is a dairyman. All 3 cases from Maharashtra. The Maharashtra government has procured in bulk sodium suramin injection. Curiously, none of the patients developed any neurological symptom. In all 3 cases, experts have failed to establish a link between the patient and the parasite. On preliminary serological screening of 1806 person from the village of first case, 22.7% people were positive by whole blood, but by serum only 81 were confirmed positive. However, no trypanosomas were detected in the blood of 60 people who were positive at a high serum dilution. Giardiasis, lambiasis, giardiasis, lambliasis, giardiasis, lambliasis, ubiquitous flagellated protozoa Giardia intestinalis, Syngiardia lambelia, Giardia duodenalis, causing infected GIT disease. These parasites are transmissible from human to dog and rodent and vice versa. Human infection worldwide prevention rate in temperate climate are 2 to 10% in adult and up to 25% in children, whereas in tropical area about 50 to 80% carrier. 2 category of people, young children and HIV infected adults, are particularly susceptible. In country, Peak incidents usually occur during the monsoon or in dry season in drought-affected area. In 11% children of acute diarrhea cases and 50% of persistent diarrhea in Delhi, giardia was implicated as cause. A staggering 67% of children with recurrent abdominal pain were harboring the parasite in Kashmir. In tea-growing community of Assam, 8% human and 20% of dog were positive of giardia. Cryptosporidiosis. 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 Cryptosporidium parvum species is mainly responsible for zoonotic cryptosporidiosis, widespread in mammals, in calf and lamb, a major cause of human diarrhea disease worldwide, especially in immunocompromised patients, based of autoinfection by thin wall oocyte. Usual transmission by contamination with thick wall oocyte. Leishmaniasis. 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 Clinical syndrome synonyms. Species. Visceral leishmaniasis, kala jar, dum fever, Assam fever, black sickness. Leishmania donovani, Leishmania donovani infantum. Cutaneous leishmaniasis, old world leishmaniasis, oriental boil, Delhi boil, Baghdad boil. Leishmania tropica minor, Leishmania tropica major. Mucocutaneous leishmaniasis, New World leishmaniasis, American leishmaniasis, Aspundia, leishmaniasis Ethiopica, leishmaniasis braziliensis, leishmaniasis mexicana. Wild animal, fox, jackal, and rodent and dogs are the major animal species involved in maintaining the natural foci of infection. In India, 3 clinical syndrome kala jar, non-zoonotic, while in rest of world dog is reservoir. Post kala jar dermal leishmaniasis PKDL, non-zoonotic chronic 2Ka. Old world cutaneous, both zoonotic, non-zoonotic, both are endemic in Rajasthan. In zoonosis, the animal reservoir was the rodent Merioness, Hurricanes, Sandfly, Phlebotomus, Pepetacea, and or P. salci was responsible for transmission of infection to man. The pattern is changing. In the temperate area of HP, previously known endemic area, 38 new cases of CL from 1988 to 2000. Sharma et al. 2003. 161 new localized cases in the Kanusur district. The new cases are increasing almost by epidemic proportion. In Rajasthan, a new focus of CL has emerged in the Ajmer city. 23 new cases between January to December and 13 new cases from January 2006 has been reported. Cutaneous leishmaniasis. Cutaneous leishmaniasis, mucous leishmaniasis, visceral leishmaniasis, post kala jar dermal leishmaniasis PKDL. Toxoplasmosis. Toxoplasmosis. Worldwide in human, especially problematic in children after congenital transmission and in opportunistic infection of immunocompromised person. Studies have estimated that up to 1/3 of world human population is serological positive to Toxoplasmosis gondii. The encephalitis due to Toxoplasmosis gondii infection can occur in up to 40% of HIV infected patients. Almost 200 human cases of toxoplasmosis were recorded for Coimbatore. Human infection, injection of undercooked infected meat, contagion cyst, injection of the sporulated oocyte from contaminated hand or food, organ transplantation, blood transfusion, heterogenic class transplacental transmission, accidental inoculation of tracheozoids in skin. Toxoplasma infection in human, immunocompetent person, acute infection, 80 to 90% clinical indifferent, pregnancy, congenital infection, abortion, neonatal death, fetal abnormality, ocular disease in death, immunocompromised. More than 90% of cases from reactivated previously acquired latent infection tissue cyst, mainly in brain, exceptionally in the eye, lung, heart, and other organ. 27% of women with bad obstetric history BOH are susceptible to toxoplasma in North India. Miseri et al. Has reported 30.9% seroprevalence in healthy individual while 67.8% in HIV patient. In the first national serological surveillance, 24.3% serum sample were IgG and 2% IgM positive by immunocapture ELISA. The lowest seroprevalence were in the north part of India with the highest in the south. In Karnataka outbreak, 20.3% seroprevalence of T1D in healthy adult blood donor has been reported. Out of 135 hospitalized HIV patients in North India, in 3.7% case cerebral toxoplasmosis has been reported. Other important infection reported was cerebral tuberculosis. An outbreak of ocular toxoplasmosis of acute acquired type rather than reactivation of congenital toxoplasmosis has been reported in Coimbatore. If maternal infection was acquired 6 months before conception, fetus is generally not affected. Toxoplasma or rubella C cytomegalovirus as herpes simplex virus type first and second. High seroprevalence of toxoplasmosis during torch testing in Delhi and Kianasur area. Sarcocystosis, 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 type of zoonosis, cyclozoonosis, defined. Sarcocystosis is a type of cyclozoonotic disease in man, clinically characterized by nausea, stomach ache, diarrhea, and dyspnea in man. In cattle, can cause fever, anorexia, anemia, loss of weight, hair loss, weakness, muscle twitching, prostration, abortion, reduced milk yield, hypersalivation, neurological sign, and death. Sarcocystis in Greek, sarcos means place, cases means bladder, are the terminal asexual stage found encysted primarily in striated muscles of mammals, bird, poikilothermic animal, and intermediate host. Sarcocystids also have been found in central nervous system and in Purkinje fiber of the heart and muscle bundle. Etiology. Different species of Sarcocystid belong to the phylum Epicomplexa and family Sarcocystidae. Sarcocystid species like flagella and cilia, but they infect the host cell by way of an organelle called the epicoplast. Species specific prey, intermediate host, predator, final host life cycle have been demonstrated. Example are Sarcocystid cruzi, cattle dog, Sarcocystid hirsuta, cattle cat, Sarcocystid hominis, cattle human, Sarcocystid capracanis, and Sarcocystid hirsiacanis, sheep dog, Sarcocystid gigantea, and Sarcocystid medusiformis, sheep cat, Sarcocystid capricanis, and Sarcocystid hirsicanis, goat dog, Sarcocystid molly, goat cat, Sarcocystid mescheriana, pig dog, Sarcocystid sui hominis, pig human, Sarcocystid porcipellis, pig cat. Reservoir and incidence. Sarcocystid species normally develop into host cycle consist of species specific prey, intermediate host, predator, final host life cycle. Apart from domestic animal, wild animal may also serve as intermediate host such as raccoon or final host coyotes for some species of Sarcocystid. After injection of Sarcocystid infected meat and meat product by the intermediate host such as human, horses, cattle, sheep, goat, pig, bird, rodent, camelids, wildlife and reptiles. They invade into the endothelium, muscle and other soft tissue and then cyst vary in size from a few micrometers to several centimeters are formed. Transmission and life cycle. Fetal dose of sporocyst is 5 into 5 multiply 106 or more. Transmission only through ingestion of sarcocyst infested meat and meat products. Bird and other invertebrates consume the parasite in egg or oocyte from the feces of infected vertebrates. The oocytes then develop into the saprozoid from in the intestine of the invertebrate. The sporozoid migrate to the animal's bloodstream and invade certain cell, which are the multiply and give rise to the merozoid form. These merozoids are carried by the blood to the animal muscles, where vitis microcysts are produced. When carnivores eat the invertebrate muscle tissue, the parasite reach maturity and reproduce sexually in the host intestine, releasing oocyte. Disease in animal. In cattle, cruzi, the most pathogenic species, the disease manifests fever, anorexia, anemia, loss of weight, loss of body hair, particularly at the tip of the tail, weakness, muscle twitching, prostration, abortion, reduced milk yield, hypersalivation, neurological sign, and death. Pregnant cow may abort and milking cow may have reduced milk yield. Hemorrhages are most evident on the serous surface of viscera, in cardiac and skeletal muscle, and in the sclera of the eye. In acute sarcocystitis, skeletal muscle are seen mottled or striped with pale area, interspread with dark hemorrhagic area. Disease human nausea, stomach ache, diarrhea, and dyspnea. Diagnosis. Presumptive diagnosis based on clinical sign and history. Periodic acid step PAS staining can be used to stain bradyzoid which contain amylopectin granules that stain bright red. Serological by ELISA. Animal inoculation method. Intraperitoneal inoculation of mice with the infected blood containing sarcocystitis result in the appearance of merozoid in the peritoneal fluid and cyst in the muscles. Treatment. Therapeutic treatment of animal has been ineffective, but in cattle, prophylactic dose of amprolium 100 mg per kg body weight SID for 30 days may reduce illness. In sheep, prophylactic administration of amprolium or salinomycin can be given. Prevention and control. The main objective in controlling sarcoidosis is to interrupt the life cycle, which will minimize the spread of sporocyst, the definitive host. Uncooked meat or offal should never be left to feed carnivores. Dead livestock should be buried or incinerated to avoid access to of carnivores. Cooking of the meat above 55 degrees Celsius for 20 minutes or at 70 degrees Celsius for 50 minutes destroyed the cyst. Freezing of the meat at 4 degrees Celsius for 2 days, minus 20 degrees Celsius for 1 day can kill sarcocystitis in male. Conclusion. A large portion of zoonosis is caused by parasite. In India, due to change in different factors, new foci of older ones or new parasitic zoonoses are emerging out. Data is still lacking on many diseases. Firstly, coordinated and effectual surveillance is required on many diseases. Awareness among people, especially for foodborne zoonoses, can be an effective tool to combat a large number of parasitic zoonoses. Thank you.